everybody. Happy Tuesday. Is it Tuesday? Tuesday?
Yeah, it is Tuesday. Oh, my dog's freaking out.
Sophie's excited. Hey, Sophie. She's excited for this live. She can't wait.
She's coming to say hi, too.
Yeah. Hey, we know it's a little bit late here on the East Coast, but on the thought that you guys might be still up studying for finals.
We wanted to say hi.
Yes, we just wanted to say hi.
We have actually had a question, and the question was, what is our story and what is our background? And so today we're going to start with Dr. Beth McIntyre's background and story, and she's going to tell us a little bit about her amazing self. And this girl is amazing. She's awesome.
You make me blush. Okay, so I was one of those kids who actually didn't know what she wanted to be when she grew up. When I was young, I really wanted to be a dolphin trainer, which I know sounds ridiculous, but in my defense,
I do it too.
I was like redheaded and I liked to swim, and so I thought I was Ariel for a while. You know, kids are weird, okay, and maybe I was a little bit more weird than most. But anyways, and so that was kind of what I want to be. And like my sister and my brother like knew. They're like, I'm gonna be this. And by the way, they did become those things. So it's really interesting how the middle child is sometimes different. But anyways, so the moment I knew I wanted to go into medicine actually happened in high school, and I was at a sporting event. I was a big soccer player. So I lived in Europe, and that was like the thing over there, right? Soccer. And so we were playing a soccer game, and all of a sudden one of the girls got hurt, and it like stopped the game. You know, everybody was like, oh my gosh, and we all kind of froze, and we're all like, oh shoot, what do we do now? Like, do we run to her? Do we not run to her? Like, you know, we're kids, we don't know. And I just remember that the team provider, which was a physician at the time, like came jogging down the steps and ran out into the field, and like he took control. Like he knew what to do. Like he corralled everybody. Like he figured it out, and like we were all freaked out, and he just was calm and everything. And at that moment, I was like, all right, I want to be that guy. Like that's who I want to be. I want to be who the people turn to when nobody else knows what to do, right? I want to be able to take charge and be able to just kind of do those things. So that's when I knew like medicine was for me. And actually for a while, I had this idea in my head that it was going to be physical therapy all through like undergrad and all that kind of stuff. And then I actually shadowed a physical therapist, and I was like, not exactly what I thought. Like, you know, and so this is why they make you shadow, by the way.
But it may not be for me.
Yeah, that's why they make you shadow for PA school, okay?
We love physical therapists, by the way.
Yeah, we work with them all the time in orthopedics. But for me, I was like, oh, you're not doing the diagnosing, and you're not doing the injections. And in my mind, I was like, okay, physical therapist, because we see it a lot, you know, in school athletic teams, and I was a big athlete. But really, it's, you know, a lot of times it's the physician or the PA that's kind of prescribing the physical therapy. And I guess in my mind, I just didn't know that. So I shadowed like inpatient therapy, outpatient therapy, like physical therapy assistant, before I finally was like, man, this isn't what I wanted to do. And I grew up as a military kid, and so I knew about PAs from the very beginning. Like my best friend's dad in high school was a PA, so it was never like a new thing to me. A lot of people don't grow up knowing about PAs, but
she grew up in Germany, by the way. Yes. Has anybody been to Germany?
Yeah. So that's, maybe I'm a little weird, but to be fair, I grew up in Europe. Quirky.
Unique.
I like that. I'm unique.
Super fun, never boring.
Yes. Anyways, still speak German some. But anyways. And so, so I finally, so I knew about PAs, and so in my shadowing, I shadowed a nutritionist, I knew I wanted health, right? Because I had that moment, that epiphany in high school, and then shadowed a PA and a physician, and then the more and more I shadowed, I was like, man, this is really what I want to do. I really like the flexibility of it. You know, I think a lot of us have like shiny object syndrome, and we're not really sure, like, do we want to go to surgery? Do we want to go to derm? Oh my gosh, OBGYN sounds so cute.
Rosie Stav was stationed in Germany.
Yes, so Rosie, cool. Where? So we were in Stuttgart and in Hohenfels. So we lived in a couple different places in Germany.
So cool.
Yeah, so I feel you, girl. And actually, I came back for college. So I came back at 18. So I was over there for quite a while, right? Anyways. And so that's when I decided, like, okay, PA is right for me. I was shadowing all these PAs, and I was shadowing one in primary care, actually, because I thought that's what I wanted to do, too. And he was like, oh, yeah, I worked in GI for a while, and then I caught babies for a while, and, you know, just like keeps getting new education, keeps learning new things. And I was like, that is amazing about the PA profession, right? That you can if you decide you want to move to a new specialty or learn something new, like there's always something. And that's really just, you know, medicine, but PAs we just have such a great career, right? We're able to move around, and you know, I came into PA school thinking primary care, like I want to get to know my patients and everything. And then I did my primary care rotation. I thought, it's okay, you know. But and then my very last rotation was my orthopedic surgery rotation. It was my elective because I thought orthopedics, right? This is exciting. I'm an athlete. Fell in love. Like, I was like, I can't believe they're going to pay me to do this. Like, in the OR, you know, music's blaring, like, we're doing surgery, patient's asleep, I'm sewing, like, we use hammers, we use chisels, like, OR is fantastic. And I thought, I never would have thought of surgical PA. I wasn't actually even looking forward to my surgical rotations, but it was so much fun. And so that's how I kind of got drafted into the surgery part and the orthopedics. I loved working with the sports teams. We shadowed a few times at University Hospital. Yeah,
Very
right.
cool.
Loved it. I know, right? It's so much
Very
fun.
cool, Peyton.
Yeah, it's so much fun. We've actually we've had actually a couple people pass out shadowing us in the OR. So like our thing was always, especially like we had some like biomechanical engineers who are really interested in like the total joint replacements. And so our rule was always like your back is against the wall. That way when they pass out, they just kind of slide on down. We once had this student shadow us, ask us where the fainting couch was because she thought she was gonna faint. And I was like, girl, this is the OR. Like, there ain't no fainting couch. Back against the wall. Back against the wall. And they would just slide on down, you know. And the nurses knew. They're like, it's okay, it's fine. We'll wake them up in a little bit after surgery.
Leave her there.
Yeah, leave her there. So yeah. So anyways. It was it's super interesting.
Got an ortho
experience.
PA goal in the house. Awesome.
Yes. Yeah. So actually, at the school we worked with, #1 requested rotation for electives with orthopedics.
Ortho. Yep.
Yeah. That's because it's so much fun. Because in orthopedics, you get to do so many procedures. So I do joint injections, and I do pin removals, and I do reductions and casting, and almost every patient I see is literally a procedure, and I love that about it. I love the procedure. I love working with my hands, and so ortho is really great. Plus, you know, you get some good patients. We actually fix people, so we manage some stuff, like manage, you know, chronic knee pain or whatever, but we actually fix some people. You got a fracture, we fix it. You got an ACL tear, we fix it.
Ooh, what do your hours look like? And Josh, that's awesome. Surgery, way to go.
Yeah.
Hi, Danielle. What do your hours look like?
Yeah, so there are a lot of hours in orthopedics, especially if you take call. So it depends on, if you take call at like a level 1 trauma center, it's going to be lots and lots of call. Okay, I took call at like a level 2 trauma center, so it wasn't so bad. So you do have a lot of nights and weekends. What you do is you usually rotate call. So I worked with a physician that's like in a big physician practice, and so we took call like once every 6 nights, and so we'd be on call. And so then you also alternate holidays. So there's like 7 holidays in a year, so 1 or 2 holidays. We took all for everything except for spine. We had separate spine guys who took spine call. And call is basically just means if someone comes into like the ER with something that's orthopedic related, like an infected joint, or they were in a car accident, now they have a broken tibia, then they call you, the PA, and you go in and evaluate them and decide if they need surgery right then or there. So there are some nights and weekends. Now, there are some PAs that only work in the clinic in orthopedics, that don't work in the OR, and then they don't take call. So they have more of a kind of 8 to 5. And so it really just depends. And there's some that only work in the OR, that don't work in the clinic at all. The thing about orthopedics is it's so different. You can work for a group, or you can work for an individual surgeon. You can work in the OR, in the clinic, or both. You can work in after-hours clinics. There's even some urgent care now that have kind of after-hour orthopedic stuff for like sports teams and that kind of thing. And so there's so many different avenues for orthopedics. So you can kind of make it what you want it to be depending on who you work with, right? So I love the OR. So we kind of did half in the clinic and then half in the OR. And I really enjoyed that. But some people like the clinic better because it is more stable hours. So it just kind of depends on, you know, your personality, what you want. My thought is first out of school, get all the experience you can. Go just work all the hours, just do OR, do clinic, do rounding, do ER work. And that way you get the experience in everything.
Find your favorite thing.
Yes, find your favorite thing. And your second job, you can be like, yeah, I know how to do that. I know how to do those injections and that kind of stuff.
Hi. So tell them about your ortho residency.
Oh, yes. Okay. Yeah. So after,
expert in ortho right here.
I just love it. So after PA school, I actually did an orthopedic fellowship, okay? And so it's very similar to applying to PA school. So you apply for a postgraduate fellowship. So I was a PAC, so I was already licensed. I had my NCC certification. I'd passed my exams. You have your DEA. You can write prescriptions. But you go back and kind of do a fellowship, which is just extra training. And so I did one in orthopedics. And not many people go back and do fellowships, but there's also not very many fellowships. So it can be kind of competitive. And I just knew that I wanted to work in orthopedics, and I really wanted to get really good really fast. And so I did a 6-month postgraduate fellowship, and that's equivalent to about 2 to 3 years in practice. And so I rotated with a whole bunch of different orthopedic surgeons. We did everything from rounding to call to ER work. I worked some inpatient, outpatient. So have done some spine surgery. I have done like foot and ankle. I've done trauma. I've done total joints. I worked with a shoulder specialist. I've worked with a hand specialist. So I've kind of have like a good idea about like all the different surgeries. I ended up working specifically for a sports med physician, and we did basically shoulders and knees with a little bit of trauma call. So that's kind of my favorite. We didn't do a whole lot of hips and pelvis, but I did get a lot of that in my training. And so fellowships for surgery specialties and for ER specialties, if you really know that's what you want to do, it just gives you that leg up on that. And so that's something that if you decide after PA school that you want to do a fellowship, like let me know and I will get you all the information on that.
Peyton Hall, we are trying to go live every day this week. And then we typically, after this week, it'll probably be about 2 or 3 times a week around the same time, but it's kind of hit or miss. But typically it's in the late evenings like this. And we love that you're here. And
Yes.
we hope that you enjoy all of this and that this is helpful to you. Proud of the pre-PA. Do you have to pay for fellowships?
Okay, so no, actually fellowships do pay you. Now they don't pay you a PA salary, right? But you are a PA, so they can bill for you. So they billed for me in the OR, they billed for me in the clinic, so they paid, and it was like enough for an apartment and some health insurance back then, right, when it was cheap. And like, to live. So it was enough to live. Like it wasn't, I can pay down my student loans, and it wasn't, I'm saving money for retirement or anything, but it was enough that like, you can, let's say 20% of like a PA salary, maybe 30%. So it's enough that you can live on, and you don't need to get more loans. But it's not it's not like a real paying job. So you do have to think, okay, well, that's going to be 6 months or a year where I'm not getting a PA salary. But then after that, you're so well qualified that the thought is you make it up, because you can be like, hey, you need to pay me 20% more because I already know how to do this stuff. You don't have to train me. And it's a lot easier to get a job too, because you have that training, right? So when you first come out of school, sometimes it's hard to get the job in the specialty you want, or the city you want. We tell our students, like, you can either usually choose the city or the specialty, but not both.
Because everybody wants you to have experience.
Right. And you will get a job. It
Yeah.
just might not be your like forever job. And so my thought was, after this, then I can kind of write my ticket to where I wanted to work. And I knew I wanted to come back to Tennessee, and that's where I wanted to work. So it all worked out for me. But they do pay you for your fellowships, yes. So that is nice.
All right, where did you go to PA school? I love orthopedics.
Oh my gosh.
Awesome.
Okay. So I went to PA school at University of Kentucky in Lexington. And the reason I chose that is, being an international girl, they do international rotations. So I actually did a rotation in Germany, and I did a rotation in English. Yeah, they were all in English, okay? But I did one in Germany in family practice, and I did one in England in pediatrics. And so really, really passionate about travel and kind of world health care systems. And so that's why I went to the University of Kentucky. Loved it. It was awesome. I highly recommend it. It was about 40 people in the class, and then they had a satellite campus kind of somewhere rural, with about 15 people, but great professors. Had a great experience there. Absolutely loved it. One of the professors there was a missionary who went back to Africa every single year, so some of the students went to Africa for rotations if you could afford the ticket over there. They did like infectious disease and a lot of just like OBGYN over there, and it was an amazing experience for them. And I love the international stuff too, and so I was lucky enough to get a scholarship through the college that paid for my time over there. And so it was really, really cool experience. So yeah, University of Kentucky, so look it up. It's in Lexington. They take about 40 students every year. So, and some of my professors are still there. I see them at our annual professor conferences for PA schools. I'll see them there occasionally. So it's really, really cool to reconnect.
Guys, this was awesome.
Yeah.
I love seeing all of you here. Let's see. UK is my dream PA school.
Yes.
Awesome.
I love you. I totally feel you.
Very cool. What were your patient care experiences you had as a pre-PA?
Okay, so I didn't have a lot of actual patient care experiences. I had a lot of shadowing, and I worked a little bit through the Red Cross. I had pretty good grades and a pretty stellar GRE, but my patient care experience was not nearly as much as like what you guys have now. And so I think I got in on like my personal statement and my grades and my GRE, because you kind of have those 4 tiers, and one of them can be a little low. They just all can't be a little low. So what I lacked in patient care experience, I made up in
personality.
Yes, that's what I say. Made up in personality. No, and I just was very open about the fact that I had shadowed a whole lot of different professions, and I think they liked that I had like shadowed this person and this person. I shadowed like 10 different specialties, not just PA specialties, but like in general, like nutritionist and physical therapy assistants and stuff. And so I think that they really liked that. And then I had done a little bit of work with the Red Cross, volunteering. I had gotten like my BLS and done some like BLS classes. I had actually taught BLS in a school out in Colorado.
Oh, that's awesome. I didn't know that. Very cool.
I was finding myself at that point. Okay, this is before PA school. But anyways, yeah, so my patient care experience was not as great as some of your guys's, but I just made up for it in other parts of my application, like my GPA and GRE. And then really your passion comes through about why you want to be PA. And I remember like there was 3 of them, and they sit down and they like grilling me, and I'm like, ooh, like 3 professors looking at you and you're trying not to sweat in your suit, right?
Oh, but you totally do.
Oh, totally. Everybody does it. Don't worry. Lots of deodorant people. And they're just like grilling me about this. And then I had to wait for the letter in the mail, and it took like forever. Okay, it probably only took about 4 weeks, but like you feel like it's forever, right? Like you're waiting.
Totally
You're like, this is my life. Just tell me yes or no. I just have to know. And so, so that was kind of my experience with it. I applied to 2 schools, and I interviewed at both, and then I got it at UK, and just I absolutely loved it. Like the second I drove up to Lexington, I was like, oh, this is my place. And so sometimes it just clicks, sometimes you just know. And the first day of school, I'll just remember I had this epiphany. Like I'm sitting there and they're telling us how hard it's going to be, and everybody's nervous and stressed out, and I just a lot of those thoughts in my life. Like this is exactly like the path I'm supposed to be on. I can feel it. But that first day, it was our orientation day. Like I was like, man, this is where I belong. I just remember I started like grinning. I was like, this is it. Like where I belong. I was probably that weird girl. I was like smiling the whole time. That weird girl from Germany, right? But yeah, so that was kind of my experience. It was like I'm in the right place at the right time, and phenomenal. Like I'm a total nerd. If I didn't have to work, I'd still be in school, like learning something. Like I don't know. So anyways, that's my PA journey. Let me know if you have any other questions about it, because it's phenomenal career, and you can take it wherever you want it. You can do as much or as little as you want. It's just you've got to get past that acceptance, and once you get that acceptance, it's like finally the rest of your life, right? So anyways, I hope you enjoyed hearing about a little bit about my journey. Everybody's journey is a little bit different. Mine was kind of but I got here, and this is where I am now. And we met about 6 years ago,
6 years
working,
ago.
And I mean, who would have thought 6 years from now, here we are, like helping other people achieve their dreams. So it's pretty cool.
We love to help you in your journey. So if you have any questions, reach out to us. And It was great to connect on here. You guys are amazing. Keep on keeping on. I know this part, the whole application process, the waiting process is so hard, but just keep your eyes on your dream and your goal. It's such an amazing career, and we'll see you tomorrow night.
All right, Katie's going to tell her story tomorrow night. So think about questions for her. This is exciting.
Bye. Good night.